Hello, everyone. Today we will learn about the morphology of the uterus. The uterus is a muscular organ with a thick wall and small cavity, where the fetus develops and grows. 1. Morphology of the uterus. The adult non-pregnant uterus is an inverted pear shape, slightly flattened anteriorly and posteriorly, with a length of about 7 to 9 centimeters, a maximum width of about 4 to 5 centimeters, and a wall thickness of about 2 to 3 centimeters. The uterus is divided into 3 parts: the fundus, body, and neck. 1. Fundus of the uterus. The uterine fundus is the part above the uterine opening of the fallopian tube, broad and convex. 2. Cervix of the uterus. The uterine neck is the narrow, cylindrical lower part, about 2.5 to 3 centimeters long in adults, consisting of the vaginal part of the cervix and the supravaginal part of the cervix. The uterine cervix is a common site for tumors. 3. Body of the uterus. The uterine body is between the fundus and the neck. The junction of the uterus and fallopian tube is called the uterine horn. 4. Isthmus of the uterus. The narrow part about 1 centimeter long between the uterine body and the cervical transition is called the isthmus of the uterus. It is indistinct in non-pregnancy but stretches and lengthens during pregnancy to form the lower uterine segment, reaching 7 to 11 centimeters by the end of pregnancy with a thinning wall. Obstetricians often perform cesarean sections here to avoid entering the peritoneal cavity and reduce infection risk. 5. Uterine cavity. The narrow cavity inside the uterus is divided into 2 parts. The upper part, located in the uterine body, is called the uterine cavity, which is a triangle with the base upward and slightly flattened anteriorly and posteriorly. The 2 ends of the base are the uterine openings of the fallopian tubes, and the apex communicates downward with the cervical canal. The lower part, located in the uterine neck, is spindle-shaped and called the cervical canal. Its upper opening communicates with the uterine cavity, and its lower opening, uterine orifice, communicates with the vagina. The uterine orifice is round with a smooth edge in oviparous. In multiparous, it is a transverse fissure, with anterior and posterior edges called the anterior lip and posterior lip. The inner cavity of the adult non-pregnant uterus is about 6 to 7 centimeters long from the uterine orifice to the fundus. The uterine cavity is about 4 centimeters long, with a maximum width of about 2.5 to 3.5 centimeters. Structure of the uterine wall. The uterine wall has 3 layers. The outer layer is the serosa, visceral layer of the abdominal cavity. The middle layer is the thick muscular layer, composed of smooth muscle, and the inner layer is the mucosa, called the endometrium. The endometrium of the uterine cavity proliferates and sheds with the menstrual cycle. The shed endometrium flows out through the vagina as menstruation, with a menstrual cycle of about 28 days. Recent studies have shown that the implantation of the fertilized egg into the endometrium is related to the apoptosis of endometrial cells. 3. Position of the uterus. The uterus is located in the center of the lesser pelvis, between the bladder and rectum, with its lower end connected to the vagina. The fallopian tubes and ovaries are on both sides, clinically collectively called uterine appendages. Adnexitis refers to salpingitis and oophorytis. In non-pregnancy, the uterine fundus is below the pelvic inlet plane, facing anterosuperiorly. The lower end of the cervix is slightly above the ischial spine plane. When the bladder is empty, the adult uterus is in a slight anteverted and anti-flexed position. When the body is upright, the uterine body lies on top of the bladder. Anteversion. The entire uterus tilts forward, and the long axis of the uterus forms an obtuse angle, slightly greater than 90 degrees, with the long axis of the vagina opening forward. Anteflexion. The uterine body and cervix form an obtuse angle, about 170 degrees, opening forward. Abnormal uterine position is one of the causes of female infertility, commonly retroverted and retroflexed, uterine retroversion. However, the uterus has high mobility, and the filling status of the bladder and rectum can affect its position. 4. Fixation devices of the uterus. The uterus maintains its normal position through ligaments, the vagina, urogenital diaphragm, and pelvic floor muscles. 1. Broad ligament of the uterus. The broad ligament of the uterus is located on both sides of the uterus, slightly coronal, composed of double-layered peritoneum extending from the uterine lateral margin to the pelvic sidewall and pelvic floor, anterior and posterior peritoneal layers of the uterus. It restricts the uterus from tilting to both sides. The upper edge of the broad ligament is free and encloses the fallopian tube. The lateral one-third of the upper edge is the suspensory ligament of the ovary. The anterior leaf of the broad ligament covers the round ligament of the uterus, and the posterior leaf covers the ovary and proper ligament of the ovary. Loose connective tissue between the anterior and posterior leaves contains the uterine arteries, veins, nerves, and lymphatic vessels. 2. Round ligament of the uterus. The round ligament of the uterus is a pair of flat cord-like ligaments composed of connective tissue and smooth muscle. It originates from the superolateral anterior surface of the uterine body, below the uterine horn, curves anterolaterally under the anterior leaf of the broad ligament, enters the inguinal canal through the deep inguinal ring, exits through the superficial inguinal ring, disperses into fiber bundles, and terminates under the skin of the mons pubis and labia majora. The round ligament contains lymphatic vessels. Malignant tumors of the uterus can metastasize to the proximal group of superficial inguinal lymph nodes via this ligament. It plays a role in maintaining the anteverted position of the uterus. 3. Cardinal ligament of the uterus. The cardinal ligament of the uterus, also called perimetrium, is located at the base of the broad ligament, extending from the lateral margin of the cervix to the pelvic sidewall. Composed of fibrous connective tissue and smooth muscle fibers, it is strong and plays an important role in maintaining the normal position of the cervix and preventing downward prolapse. 4. Uterosacral ligament. The uterosacral ligament is composed of connective tissue and smooth muscle fibers. It curves posteriorly from the superolateral posterior surface of the cervix, wraps around both sides of the rectum, and terminates on the fascia anterior to the second and third sacral vertebrae. Its surface is covered with peritoneum, forming the arc-shaped rectouterine fold. This ligament pulls the cervix posterior-superiorly and cooperates with the round ligament to maintain the anti-flexed position of the uterus. If the uterine fixation devices are weak or damaged, abnormal uterine position may occur. If the uterine orifice is below the ischial spine plane or even protrudes out of the vagina, it is called uterine prolapse. 5. Age-related changes of the uterus. In newborns, the uterus is above the pelvic inlet. The fallopian tubes and ovaries are in the iliac fossa. The cervix is longer and thicker than the uterine body. Before sexual maturity, the uterus develops rapidly, with a thickening wall. During sexual maturity, the cervix and uterine body are almost equal in length. In multiparas, the uterus is larger, all diameters and the cavity increase, and the weight doubles. After menopause, the uterus atrophies, becomes smaller, and its wall thins. Everyone, in this class, we have learned about the morphological characteristics of the uterus. In the next class, we will start learning about the endocrine system. Thank you.